Friends, I am Dr. Kamal Bachani and I am practicing as an orthopedic surgeon in some of the reputed hospitals of Delhi. Today I will be talking about the shoulder joint problems. My interest in shoulder joint grew in last 2 decades. What attracted me, this is one of the joint which affords wide range of mobility. It has got a uniqueness in the body that it affords wide range of mobility which is required from taking your shoulder and hand at your back from the front. So it affords a wide range of mobility. But this wide range of mobility of the shoulder comes at a price. It gives the shoulder joint makes it comparatively unstable compared to other joints of the body. Now, disorders of the shoulder most of the time patient comes to us for shoulder problem in the form of either pain in the shoulder, or there will be stiffness of the shoulder, like a lot of patient comes to us with the so-called frozen shoulder, or even they may be coming to us with arthritis of the shoulder, or they will come to us with shoulder becoming very unstable, like recurrent dislocation of the shoulder and so on. Now, if you broadly want to categorize shoulder disorders, they can be in the form of one, impingement, where there are muscles and the bones getting impingement on the bone above or the arch above, which is known as coracoacromial arch. So patient may come to you in the form of impingement. Impingement can be external from the outside the shoulder, can be internal from the structure which are inside the shoulder joint. The other problem which we often see in our clinical practice in the shoulder is the stiffness of the shoulder. It can be of two types. One is primary stiff shoulder, which commonly or erroneously is labeled as frozen shoulder. The other can be because of the injuries around the shoulder. Patient may have a secondary stiffness of the shoulder. Then the other disorder which we have often talked about is instability of the shoulder. We have seen a lot of sports persons come to us with the shoulder getting dislocated, or multiple times they get dislocation because of the tearing of the structures, and it robs them of their good number of professional years, and their careers are at times spoiled. Endpoint of all these disorders, or in a neglected cases following injuries, fracture, etc., sometimes can result in arthritis of the shoulder, which we would like to avoid at any cost, because arthritis results in significant cartilage damage, and the choices and options, especially in young persons, become limited. What is more important in shoulder, which we have observed, is the proper diagnosis, proper understanding of the mechanism of the injury. Because if you don't understand, you don't diagnose them correctly, you will end up creating wrong results. Many times patient comes to us with a erroneously diagnosis of frozen shoulder. They are labeled any pain or stiffness or disability sometimes, and even by the medical personnel is labeled as frozen shoulder. Please, important is to diagnose them correctly. Once you are able to diagnose them correctly, then the treatment becomes simple. I would say more than 60 to 70% of the shoulder disorders can be managed by simple, proper diagnosis, medication. At times we may require some invasive procedure like an injection or something, and in some cases where these things are not working, only then we resort to operative intervention. Operative intervention is also now very highly advanced, and majority of the surgery in the shoulder can be done by arthroscopic or keyhole surgery. But again, I would like to emphasize, even though I am doing arthroscopic surgery of the shoulder, still if I treat 100 shoulder problems, in only 10 to 20% of the cases we need to do arthroscopic shoulder surgery, because these are simple things which, if diagnosed correctly at time, can be managed by simple measures. But if they are neglected, the results sometimes can be disastrous. My booking can be done on LabRate. You can do online booking on LabRate.